So the types of pelvic health issues that women can encounter are really wide ranging. They can have bladder issues, so frequent urination, urgent urination, even bladder pain. All of these are very common pelvic health issues for women. Urinary incontinence is very common. The urinary leakage that happens with coughing, sneezing, laughing, or urinary leakage that occurs with a sudden urge to get to the bathroom. In addition to urinary incontinence, patients can have loss of bowel movements called fecal incontinence. This is one of the most distressing types of pelvic health issues that women can encounter. There are other types of issues that we often call prolapse, and this is a vaginal bulge. So a woman might notice or feel or might even see a vaginal bulge sort of pushing out of the vagina. This can be the bladder, it can be the uterus, it can be the rectum, it can be intestine. All of these are sort of put together as something called pelvic organ prolapse. And these can cause lots of different symptoms depending on what's prolapsing. Maybe the most common pelvic health issue are urinary tract infections. Urinary tract infections are actually the most common reason why women visit a healthcare provider. And so this is something that affects millions and millions of women every year. But pelvic health issues have a few things in common. One of the things that they have in common is how many women experience this, right? So we're talking about tens of millions of women in this country every year who experience some type of bothersome or symptomatic pelvic health issue. The other thing that I think is common about them that they all have in common is how hard it is for some people to talk about them, right? So a lot of times we're embarrassed to discuss these, and maybe even when we finally have gotten the courage to talk with a healthcare provider about our pelvic health issues, maybe we kind of felt shut down. Maybe it's something that they didn't want to talk about or didn't want to address, or said it's just part of getting older or something like that. And so oftentimes the hardest part about addressing pelvic health issues for me is just letting a woman know that it's okay to talk about this, right? That I'm interested in hearing about your pelvic health issues. I specialize in your pelvic health issues. I want to help with your pelvic health issues, and this is the right place to discuss them.